Bro, did you know they named the bicuspid valve after the biceps brachii? Dude! Bet you learn now. That means they probably named the tricuspid valve after the triceps, bro! Dude, bro science! You learn something every day. Oh, yeah. Bruh. What's up YouTube? Welcome back to Nursing Basics. In case you're new here to this channel, my name is Ronald. I don't know where those two goons got their cardiac knowledge from, but it's not that good. Today we're going to be talking about the basic anatomy and blood flow of the heart. We're not going to be using this rinky-dink little model here. Oh no. Here at Nursing Basics, we've got the big boys. We've got that cardiomegaly. I'm a firm believer that if you can't explain something to a 4 or 5-year-old, you're not doing it right. By the end of this video, you're going to be a freaking expert on the blood flow and basic anatomy of the heart. Let's do this. Alright guys, so before we get started, keep in mind, this is the right side of the heart, this is the left side of the heart. I don't know how it's going to be flipped on your screen, so keep that in mind. Right side, left side. The heart consists of 4 chambers. The atria, you have the right atria and the left atria, and the right ventricle and the left ventricle. The atria are on top, the ventricles are on the bottom. You've got this pulmonary artery, the aorta, the superior and inferior vena cava, and the pulmonary veins right back here. So now that you have a reference for right and left, let's do this. Alright guys, so we're going to get started with the basic anatomy. I'm going to give you a rundown with the chambers closed and the heart closed so you can understand it like that, and then I'll take these covers off so you can see the insides of it. So on the right side we have the superior and inferior vena cava. Here it is, the superior and inferior vena cava. Then we have the right atrium and the right ventricle. And in between these two chambers we have the tricuspid valve. Then we have the pulmonary artery. There's the left branch and the right branch is right here. Then we have the pulmonary veins. Here's the left branch. Here's the right. And these bad boys bring blood back to the left atrium. We have the left atria and the left ventricle. And in between these two chambers, we have the mitral or bicuspid valve. The left ventricle then goes to the aorta, and that takes blood to the rest of the body. There you go. We stripped it of its clothes, it's naked, let's talk about it. So here's the superior and inferior vena cava again. That hasn't changed much. Then here, the upper half is the right atrium. Here is the tricuspid valve. Here is the right ventricle. Here is the pulmonic semilunar valve. And the pulmonary artery is right up here, kind of got ripped off. Then we have the pulmonary veins right here, and there should be one over here, but it got taken off. Then we have the left atrium, the left ventricle, and the bicuspid or mitral valve. Then right in here, we have the aortic semilunar valve. And then finally, we have the aorta. There you go, basic anatomy. So I know what some of you guys are thinking. Ronald, how am I going to remember which valve is on which side? Here's a dumb way that I remember. Tricuspid is on the right, bi is on the left. Ronald, what if they use the mitral valve on the test? Here's another way. Tricuspid has an R on the right. Mitral ends in an L on the left. Ta-da! Problem solved. We're going to talk about the blood flow through the heart. I want to do this with the covers off. That way it'll give you a better understanding and a better visual of how the blood flows. So, blood is brought back to the heart. Oxygen poor blood is brought back to the heart via superior and inferior vena cava. Remember this bad boy? Superior, inferior vena cava. And that takes blood to the right atrium. Then in order to go to the right ventricle, it has to pass through the tricuspid valve. After it is in the right ventricle, it is then pumped to the lungs through the pulmonary semilunar valve into the pulmonary artery, and that gets taken to the lungs. Then after gas exchange has occurred, oxygen-rich blood is brought back to the heart via the pulmonary veins. There's also 2 over here, but it's missing from the cover right there. Then after it's brought back via the pulmonary veins, it enters the left atria. After the left atria, it passes to the left ventricle through the mitral valve, the bicuspid valve, or the atrioventricular valve, whatever you want to call it. Then the left ventricle is this big, beefy, muscular guy that pumps it out to the rest of the body. In order to do that, the final valve it passes through is the aortic semilunar valve right in there. Then it enters the aorta and goes out to the rest of the body. That's it. You're an expert. All right, guys, just to top it off, we're going to do a recap of the basic anatomy and blood flow of the heart, starting with the basic anatomy. On the right side of the heart, we have the superior and inferior vena cava, the right atrium, the tricuspid valve, the right ventricle, the pulmonic semilunar valve, and the pulmonary arteries. Once gas exchange has occurred, oxygen-rich blood is brought back via the pulmonary veins to the left atrium. Now we're on the left side. On the left side we have the left atrium, the bicuspid or mitral or atrioventricular valve, whatever you want to call it, and the left ventricle. Then we have the aortic semilunar valve somewhere in here and the aorta. There you go. Now we're going to do a basic recap of the blood flow. Here we go. Oxygen poor blood enters the heart through the superior and inferior vena cava into the right atrium. The right atrium contracts and oxygen poor blood passes through the tricuspid valve into the right ventricle. This is still oxygen poor blood, and the right ventricle contracts and sends it out through to the lungs through the pulmonary arteries. Then in the lungs, gas exchange occurs and oxygen-rich blood is brought back to the heart via the pulmonary veins. So now we are on the left side of the heart with oxygen-rich blood. Oxygen-rich blood enters the left atrium. The left atrium then contracts, passes through the bicuspid or mitral or atrioventricular valve into the left ventricle. The left ventricle then does its final contraction, pumping oxygen-rich blood through the aortic semilunar valve into the aorta and into the rest of the body to perfuse the rest of the tissues. Well, there you go, guys. Now you're an expert on the basic anatomy and blood flow of the heart. I'm proud of you for learning. Cheers. Don't forget to like and subscribe. Leave a comment down below if things are unclear. I'm more than happy to respond and help you guys out. That's what this channel is all about, learning and helping each other out. So let's do that. I'm also going to make a Quizlet for this video over the basic anatomy and blood flow of the heart. Make sure you keep an eye out for my next video. It's going to be over the electrical conductivity of the heart, aka the SAAV, bundle of his Purkinje fibers, right and left bundle branches, all that stuff and what it all means. Well, there you go. You just learned the basic anatomy and blood flow of the heart. Don't forget the basics of life. Be kind and do good. Peace out, guys.